Dr. Ricketts, can you help me make it through?
Doc On JOX, man, what's up?
Just you guys, what's going on?
Not much, Doc.
Now, I'm seeing in the news headlines, new cholesterol guidelines are out.
Yes.
What does that mean? They're changing the way they score whether I'm fat or not?
Well, let me tell you what. No, sir. And no, you're not fat. And not even overweight, Jimmy.
Well, I
mean,
appreciate
come on,
that.
man.
I appreciate that.
Well, you know, everybody looks at that, and first thing everybody would think would be Obamacare.
Oh, yeah.
Yes.
This has
Another government regulation.
this has nothing to do with the United States government, and that's the wonderful thing about this.
Well, then
is
it might work.
So they're not skewing the numbers to try to cover up for some kind of insurance or anything?
Absolutely
No. Okay.
not. This has got nothing to do with the United States government, but it's the first huge change we've had in how we treat cholesterol in over 30 years, and it's coming right out of the Cleveland Clinic, which is your #1 heart hospital in the United States. I mean, a lot of guys would say Baylor and those places in Texas, but Cleveland's your place that puts out good, solid, hard data. And this came out of 30 years' worth of studies they have done at looking at cholesterol. And it's going to radically change the way we approach that magic number. Now, as the government, but more importantly, insurance companies and businesses going to be getting involved in this, you can bet your boots on it. And it's coming. So I figured, let's talk about what this huge changes, because you can't turn on anything media-wise hardly and it not pop up.
Okay, so tell me what's changed and what should I do?
Well, here's what we're going to do. It's going to be lifestyle changes. I mean, I know that sounds radical, but it is the hardest thing to do. Everybody wants to take a pill and make it simple. There's all this bad news about all the bad cholesterol drugs and all that. Well, the biggest change here is going to be modifications of lifestyle and diet. As we want people on the Mediterranean diet, we want them exercising at least 4 times a week, 30 minutes, to try to work and bring down cholesterol levels. If you look at the Greatest Generation, they actually, coronary artery disease-wise, had less coronary disease because they exercised, they burned off calories, and other than that period we went through fried foods, actually ate better. So it's something, if you look at older patients that don't have genetic problems, they're bringing forward. Now, what we're going to do is we're going to start screening for risk factors a little bit differently than what we have. Currently, the big numbers have been that your total cholesterol be below 200 and your LDL or bad cholesterol be below 100. And if you have very high risk factors, try to get that number below 70. All the public health gurus have always said, well, it's better to have a target number absolutely for people to shoot for. And that's we've just used that broad brush and painted across the board. You know, people say, well, what about my good cholesterol number and all that? Well, we think that helps, but we really don't have any way to make that better other than to exercise and drink a glass of red wine every night. And for those folks that don't drink, of course, that ends up being a major problem. Now, listen, here are things, screening risk factors. If you're a diabetic, it's going to affect me, you should be on a statin drug. Now, I've kind of taken them periodically, but I'm about to embark upon taking a statin drug every day because it jacks up your risk of coronary disease astronomically. Yes, after the baby gets here, we're going to talk about that with you guys too. If you have an LDL or bad cholesterol greater than 190, now these are their numbers. I'm going to tell you if it's greater than 170. I could put you on the Mahatma Gandhi rice and water diet, and that bad cholesterol number is not going to change, because that is usually an indicator that individuals have a genetic tendency to have high cholesterol numbers. And I know we'll get a caller that says everybody in my family had cholesterols around 300 and a bad cholesterol around 190, and none of us have had coronary disease. No, you just all died from strokes. So if you've got this lowered number or got this higher LDL or bad cholesterol number with that family history, you're going on a statin drug. Heart disease. If you've got any family history of heart disease whatsoever, for whatever reason, and we're talking vascular, not valvular heart disease, but we're talking about coronary artery disease, heart attacks, angina, stents, anybody in your family, you're going to go on a statin drug, or we're going to recommend you do. If you have a cardiac risk factor, and you're going to start seeing us calculating this, and this is going to be the big thing I think you're going to see happen. A cardiac risk factor number greater than 7.5, we're going to recommend you go on a statin drug. Now, that risk factor is calculated, and I won't get into all the complication or the calculation of it, but you base it on age, sex, race, total cholesterol, HDL cholesterol, blood pressure, smoking, and history of diabetes. But in those individuals, we're going to recommend going with statin drugs. Now, what they're going to recommend with this, we're not going to go with these higher doses that have caused everybody, and we'll get calls too that I took them and I had horrible muscle pains and I got to where I couldn't walk and I swole or had all this swelling in my legs. We're going to start a little lower. We're going to bring that up, but you're going to go on it. We're going to stay on it, and it's not necessarily going to be a hard and fast number that we're going after, and that's what this big study at the Cleveland Clinic was about. The data out of Framingham Heart Study, not totally released on this part yet, which is the longest ongoing heart study, which is almost 50 years old now out of Framingham, Massachusetts. But they're coming up with similar numbers too, that if you've got these risk factors, then probably 30s, certainly 40s and 50s, we definitely want to start this, properly monitor it, get it started. And the numbers over this data definitely show the decrease in risk of heart attack and stroke and peripheral vascular disease has been just phenomenal. It's going to be highly debated next week at the American Heart Association meeting when they have their annual convention. Now, one thing I'll say about it, and that's the one thing that you haven't heard talked a lot about, but heard Dr. Sanjay Gupta talk about this morning. This study has not proven that it's going to increase the length of your life even by doing this. It's just talking about that you're going to decrease your risk of a major cardiovascular event during your lifetime with that. But it's not necessarily going to make you live longer. That has not yet been proven.
Yeah, but the other has a potential to shorten it. So
most definitely, and that's what I think, and that's the point he brought this morning talking about on CNN. We're going to see probably over time, because these studies will be ongoing and they will continue to look at this data, that we are going to see lifespans expanded because we don't have these huge cardiovascular events. Now, a money thing. We're fixing to double the number of Americans taking a statin drug. We're going to go from about 12.5% of Americans to almost 25%, or 1 out of every 4 Americans being on a statin drug for multiple decades.
Invest.
Invest in Merck. You know, the Crestor still is a prescription or is a brand name drug, but there's Simvastatin, which was the Zocor, and Pravachol. You've got Lipitor's generic now. Any stock in those companies is going to be huge. And the labs where you do the testing, it's going to go up. That, I tell you, these numbers are going to be huge. They're talking the initial impact of this in our country is probably going to be somewhere between $66 and $74 million annually by doing this. So it's going to be huge. But the data's good. It's not good. My biggest thing I wanted to get to everybody out there, this isn't the government trying to manipulate data on you. This is stuff you can actually believe in. But we're going to work more globally on lifestyle changes with the diet and exercise, getting you up off your butts, getting you out exercising, getting that weight under control, getting the blood pressure under control in the process of doing that so we can fight these things, not just sticking everybody on a statin drug. But I can promise you I've already started today with mine, and I'm going to do that.
But you just told me 1 in 4 Americans is going to be on a statin drug.
Yeah, it's going to happen because you know what's going to happen? Most folks, it's the hardest thing I have to do in practice, is to get you up and to get you start doing something exercise-wise and losing that weight.
What you should do is say, listen, I meant to send you here to exam room 2. I need you to go to exam room 16. And then you go to 16 and say, I'm sorry, I need you to go back to 2. And you go to 2 and say,
double
back
time,
to 16.
I've got a better thing than that. I like to tell these guys their wives' boyfriends will be more than happy to spend their insurance money when they're gone. And I tell you, that gets a lot of viewpoints.
A couple of calls before we take a break, and then we'll finish with nothing but calls the rest of the way out here. Let's go to first Brian in Birmingham, who was up first, holding the longest. Hey, Brian, you're on with the Doc on JOX.
Hey, Doc. Hey, guys. Doc, I'm a patient of yours, but haven't been in there in a while. Probably need to get in there. But
well, come see us.
As I get older, I'm 38 now, I get more scared of heights. Looking out from buildings and stuff. And
Sure.
Last night, I was in a hotel on the 3rd floor, no big deal. But every time I shut my eyes, I felt like I started to fall.
Yes.
And so, needless to say, I didn't get a good night's sleep. I woke up, and physically jumping while I was asleep. Is there anything that can cause this? I mean, I haven't changed, like, caffeine intake or changed my diet at all. Is it stress? I mean,
Well, let me tell you, the only way to change it, you're not going to like it. You're going to die. So it's just it's something that changes with brain chemistry, and I don't know what it is about this time of the year, but flying, LT, tall buildings, anybody that has problems with heights and those sorts of things, for some reason, as we make that move into the shorter days, it changes the brain chemistry somehow that tends to bring that kind of phobia in place. It's easy to treat. Usually an anti-anxiety medication during this time of the year will make a huge difference, and it'll help all during the year. It's just something that happens as that brain chemistry changes as you get older, and then you get these light and dark changes. Yeah, everybody's under more stress. My Lord, we got the holidays, 6 weeks away from Christmas and stuff, and not that we need to know about that, and potentially 8 weeks away from going to California. So there's a lot of things on people's minds right now.
Brian,
So
I think it's psychological. At age 38, man, you're just enjoying your life more. You're afraid for falling out that window and ending it all. At 18, you didn't care. Your life stunk at 18.
Well, I have 2 kids. We just moved, and I'm on the road a lot, so there is a little stress, but I guess it's all subconscious that I'm not paying attention to.
Yeah.
Hey, another good thing, too, is regular exercise. I mean, again, a lot of folks getting the blues, getting this seasonal affective disorder and those sorts of things. A little exercise, a little running, a little cardiovascular.
So nothing changes with his inner ear or anything like that when you get older. He's just...
It's a brain chemistry thing as we get older, but it tends to happen.
Hey, Gene's in Northport before we take a break. Hey, Gene, how are you? You're on with the Doc on JOX.
Hey, man, how y'all doing?
Doing great, man.
Got a question. I heard a couple of weeks ago, well, let's say that I'm 44 years old. I hadn't had any kind of, as far as anything really going wrong. I guess I'm pretty healthy, I guess, for what you want to say. But there's times that I'll sit there and you're talking about testosterone levels and such like that not too many few weeks ago. There'll be times I can get out of bed as far as in the morning, I feel like I'm stiff as a board.
Yes.
There'll be times that I can sit there and I can bounce up and just do anything I want to all day. And just those times that you feel like if you're just don't have any energy and you walking around like you just, like I said, it's like you're stiff as a board and everything. And could that be anything that could be attributed to that, or is that something that, what would I need to check out first as far as to try to get that straightened out?
Well, most certainly. And the people that don't understand the geography of the Tuscaloosa area, you're sitting right there on the edge of the Sipsey Valley in there, right where it's almost like Tornado Alley as you're going up through Northport, Gordo, going up toward Pleasant Grove and Union Grove and all those places. You have all this moisture and these weather fronts. If you watch the weather maps, almost every weather front that collides in Alabama collides in that valley. Anybody that says that the weather doesn't affect joint pain, that's a bunch of hooey. Listen, it does. I mean, I've watched people from down in that area. It's probably twice as bad in that area as it is here. Low T can certainly cause those type feelings, but I tell you, the type weather changes we've had down there too in the last couple of weeks are notorious for that. But yeah, go see your doc, get your testosterone checked, maybe do an arthritis panel on the sedimentation rate, and look and see if we've got any kind of arthritis going on, because there's tons of rheumatoid arthritis and lupus and those sorts of things in that area too. And get them checked and see what you got, and we'll come up with a game plan and get you better.
Okay. All right. I appreciate it.
All right, Gene.
Okay. But nothing to do with his low T, most likely.
Well, I'd say it's 50-50. That is not an uncommon complaint I hear out of guys around 44 to 45 with that.
All right, 16 after. Quick break here, then more phone calls for the Doc on JOX. Speaking of which, the Scholar Athlete of the Week is?
Well, we got a huge one today, Mr. Will Brewster. You might watch the Mountain Brook Spartans in basketball or football, real familiar with Mr. Brewster. He's got a 4.12 GPA, scored 32 on his ACT. To say the least, he's a member of the National Honor Society. He played both football and basketball, and I love the fact the guy is in the ping pong club over at Mountain Brook.
You got a lot of clubs if you got a ping pong club.
Yeah, you're doing all right. But he played all 4 years on the Spartans varsity football team and 3 years on the basketball team, quarterback on the football team, and named Birmingham All-Metro player last year. He made the 6A state quarterfinals in sophomore and junior year, and a 6A player of the week as a junior. Dynamic kid, again, one of Mr. Pruitt's young men who loves AP U.S. history over at Mountain Brook. Listens to everything from Kendrick Lamar to Matchbook 20. That sounds like me listening from Merle Haggard to Jay-Z. So, Will Brewster, congratulations, young man, on an excellent high school sports career.
All right, 24 after. Let's go to William in Alabaster. Try to get some of these calls in with the Doc on JOX. William, how you doing?
I'm good. How are you guys today?
Wonderful.
Hey, Doc, I got one that's going to stump you. You ready?
Hey, listen, we've done it 4 times in 6 years. Let's bring it on, baby.
All right, I'm 37. I've been running a good bit lately, dropped a lot of weight. Just had a physical. Everything's great. competed in my first half marathon this past Saturday.
Okay.
After the race, I noticed, not during the race, but after the race, there was on both sides of my feet and up into my ankles and the back of my leg just a little bit, a numbing sensation that has not gone away since Saturday.
Oh, come on. You can do better than this. All
Later.
right, well, let me tell you what it is, because this is not uncommon with long-distance runners. You're actually having a version of something known as tarsal tunnel syndrome. And once you quit the race, you're still throwing off heat. You'll have some mild swelling in the ankle areas, both from trauma and from heat reduction, particularly in the weather like we had last weekend. It will put slight pressure on the nerves, the dorsalis pedis and the posterior tibial nerve that supplies feeling to the feet, and particularly that posterior tibial nerve that comes around the outsides. That's real common. It may last for a week or two. I'd go with a non-steroidal drug, keep them propped up, ice them down. That's why next time you run a half marathon, when you get back to your hotel or something, take a lukewarm to cold shower and just get the hose and just get your legs really good with that. And that'll help you from not doing that again. But that's real common, but I appreciate you trying to stump the professor, but that isn't going to happen today, bud.
I think you should throw one more thing in there. My wife is listening, and I think you should tell her to rub on them a little bit, too.
That's right.
Absolutely.
Every night.
Absolutely.
While you watch ESPN.
Hello.
There you go. Thanks, guys.
All right,
You got it, man.
Let's go to Scott in Birmingham. Hey, Scott, what's up?
Hey guys, love the show.
Thank you.
Question for you. I was a competitive swimmer from 7 up through college.
Okay.
7 now. And my shoulder for the last 3 or 4 months has really been aching and, hurts to put shirts on and t-shirts,
Yes.
that kind of thing. And didn't know if maybe some of, all that rotation during those years might have done something. I really don't want to go to the doctor and have an MRI or something like that, but any suggestions on light rehab or what?
Absolutely. Well, I still would go with the doctor. We're not going to cut on you at all. More than likely, there is some scar tissue. I mean, you can't help but have to competitively swim all those years, and I think all of us have had children or have done it ourselves all these years. You're going to get some scar tissue and inflammation and wear and tear in that shoulder socket, particularly in the bursa and tendon areas. I think going with a mild non-steroidal drug along with some physical therapy that you can get taught by a therapist, the correct way to do it and doing that at home will help you immensely. Let me ask you, what were your big events that you usually swam in?
It was backstroke and sprint free.
Yeah, that's particularly the backstroke, particularly long guy and stretching and going that's probably that and the butterfly are your two most common strokes that give you long-term effects later. But it can be fixed, it can be rehabbed, and nobody's going to MRI you, nobody's going to cut on you. You're going to do fine.
Okay. Well, that's super. I appreciate it.
You got it,
All right,
man.
Scott.
David in Atlanta is on with the Doc on JOX. Hey, David, how are you?
Good. How are y'all doing?
Wonderful.
Good. I tore my ACL and had reconstructive surgery about 6 months ago,
Yes.
and with a hamstring graft, and we found out that one of the screws in the tibia is coming loose and kind of bulging out a little bit.
Okay.
Is surgery really the suggested option for that? What's the recovery and kind of that whole surgical process like?
Well, let me tell you, and I'm not an orthopedic surgeon, so I'm going to preface it with I don't know a lot of the things that you're asking. I do know this. There's no other way to fix this than to go back in and replace the screw. You're probably talking to a 4 to 6 week rehab period, which I know if you're a runner and stuff, it's not too cool, or even playing recreational soccer because we're still in the middle of seasons. But that's the only way you're going to fix that is to replace that screw and for it to be resubmitted and put back in place. Hopefully it's just a minor adjustment that needs to be made there, but they got to get a look at the tibia and they got to get a look at where this thing was put in. But really, it's the only thing you can do. You're going to now, obviously, and hopefully, they've got you doing exercises to build up the muscles around your knees. That'll help tremendously, and that'll really speed up that recovery time. Dr. Andrews and Dr. Lee Mack really pioneered that here in Birmingham to getting people doing their rehab on knees and hips prior to the surgery and really accelerating that post-operative recovery period.
Okay, well, thanks, guys.
Sure.
David, thank you very much. And that's our time this week for the Doc on JOX. If you'd like to make him your primary care physician, it is real easy to do.
Yeah, make that call that we make, 822-0233. That is 822-0233.
I would assume on your website you have some thoughts coming up about the new cholesterol guidelines. You'll put a thought or two up there, or this video or something?
You bet. My colleague Harry Long will be writing it down, and we'll get the formal everything up there. But yeah, just go to markrickettsmd.com. Everything you need to know about our practices there. follow us on Facebook and Twitter, and we just love to look forward to seeing you.
All right, that's 24 hours a day right there online, and the Doc on JOX is with us every Wednesday on the show, and he's back with us again next Wednesday when we come back.